Very good morning. I am Dr. Ashish Arya, MBBS. Today I will talk about balanced diet. How to use balanced diet in a easy way. Every food, keep it in mind, it is very important point. Every normal food, if it is taken in normal amount, normal proportion, with right combination, is a balanced diet. We have not to think that any food is healthy or unhealthy. It depends whether we are taking in right amount or not. Every nutrient is important for our health. Deficiency of any nutrient will cause disease. Some will cause early disease and some will cause disease in 5 to 10 years. But keep it in mind, every nutrient is important and every normal food, if it is taken in normal proportion with right combination, is a healthy food. Some people blame carbohydrate for unhealthy food. Some people say that fat is harmful for health. All these things are incorrect. If we want to understand balanced diet, we must start from this point. Every nutrient is important. Every diet can be balanced. So, first of all, we understand the basics of balanced diet. Definition of balanced diet is that the diet which contain every nutrient in right proportion, right amount, according to our age, according to our workplace, according to our work, according to our calorie requirement, according to our probable disease, or according to our running disease. Because every diet is specific. Single diet chart doesn't work for everyone. We have to understand the basics of balanced diet. There are two type of nutrients. Some provide us calorie, some does not provide us calorie. Those nutrients which provide calorie are as important as those nutrient which does not provide calorie. The nutrients which provide us calorie are carbohydrate, protein and fat. All these nutrients provide us calorie. Some nutrients are required in large amount and some nutrients are required in small amount and even very small amount like microgram. Nutrients which are required in large amount are carbohydrate, protein, fat, fiber and water. The nutrients which are required in a small amount are vitamins and minerals. We have not to remember every vitamin name, every mineral name. If our diet is balanced, every nutrient will come in right proportion. We have not to remember the amount of vitamins, amount of minerals. Just keep the basic formula, which I will explain later. So those nutrients which are required in large amount are as important as those nutrients which require in small amount. Daily calorie requirement for a normal person is 1800 to 2200 calorie per day. Knowing the amount of calorie is not as important because it doesn't work in our balanced diet. We have to understand that percentage of calorie from the protein, percentage of calorie from the carbohydrate, and percentage of calorie from the fat is most important to understand balanced diet as compared to the amount of calorie. If we take a right percentage of calorie from protein, carbohydrate, and fat, there is no need to worry about the amount of calorie, because there are plenty of foods which contain different calories, and even preparations of food may alter the amount of calorie. It is a complicated formula if we go from by amount of calorie, but if we go by percentage of protein calorie, carbohydrate calorie, and fat calorie, it becomes easy. This formula become more easy when we use only protein percentage calorie, because percentage of calorie uh, from protein is more important. So first of all, we know the percentage of calorie from different nutrients. From protein, we have to take 10 to 15% calorie. From fat, we have to take 20 to 25% calorie. And from carbohydrate, we have to take 60 to 70% calorie. We are saying that the percentage calorie is from protein is required less as compared to the carbohydrate and fat. Minute change in percentage of calorie will cause deficiency of protein, but minor changes in the carbohydrate and fat calorie will not going to affect much. In most of the diet, percentage of the protein calorie become less, because if we increase the percentage of calorie from carbohydrate or increase the percentage of calorie from the fat, will decrease the percentage of calorie from the protein. That is important. Take the example of pulses and almonds. Amount of protein in pulses and almonds is nearly same, but the percentage of calorie are different. Percentage of protein calorie in pulses is 28%, and percentage of protein calorie from almonds is 14%. Just double in pulses. So pulses contain more amount of protein when we are comparing in protein calorie percentage. So protein percentage calorie is more important than the amount of calorie. If we take a normal diet and keep percentage of protein calorie from 10 to 15%, we will get the normal amount of protein. But our percentage of calorie is 5 to 7%. Even we are taking normal amount of protein, we were not going to get right amount of protein. So percentage of protein calorie is important. One more important thing about percentage of calorie is that it is very easy to use when we sit on the dining table, because we have not to calculate the calorie, we have not to measure the amount how we are taking, but just right combination. I will explain it properly. We have to make a list of food item in a month we are taking, and we have to divide in a two group. In first group, we have to keep all those food items which contain protein calorie percentage less than 10%. In second group, we have to keep all the food items which contain protein calorie percentage more than 10%. We have to take the right combination, those things which contain less protein with those food items which contain large amount of protein. Just we have to this two combination. We have to understand this few example. Suppose we are vegetarian. We take Indian bread, that is roti, which contain 10% calorie from the protein. If we add little amount of ghee in it, the percentage of calorie decrease by 2%. It become nearly 8%. If we are taking sabji with that and sabji contain oil, then percentage of calorie will decrease to 6 to 7%. In these food items, if we add pulses, boiled pulses, the percentage of calorie become 12 to 15% because percentage of calorie from protein in pulses is near about 28%. If we remove pulses from the vegetarian diet and just take green vegetables and Indian bread with ghee, the percentage calorie will decrease and it will cause many disease. Not in 1 to 2 years, it will cause disease in 10 to 15 years. So percentage of calorie is more important. In Indian population, where the percentage calorie is 10 to 15%, the diseases like diabetes, high blood pressure, high cholesterol are very less as compared to those diet which contain 5 to 6%. Most of the diabetic patient and heart attack patients, in their diet, percentage of calorie is 5 to 7%. Whether we are vegetarian or non-vegetarian, it doesn't matter. We have to keep protein percentage calorie from 10 to 15%. Keep it in mind. If our food contain more amount of sugar, the protein percentage calorie will decrease. If our diet contain more fat, protein calorie percentage will decrease. Some factor which increase the protein calorie percentage, we should know about it. If we exercise for 1 or 2 hours, our calorie requirement increase. If calorie requirement increase in our food, if it is protein calorie percentage is 7%, then we will get more protein calorie percentage because amount of calorie is increased. Keep it in mind. If calorie requirement is increased, even if the protein calorie percentage in our food item is 7 to 8%, it will become 10% because fat requirement is increased and protein calorie percentage will increase. If we go on the fast, it will also cause protein calorie percentage increasement. So these are the some basic point about the balanced diet. If you have any question about the balanced diet, you can ask. Thank you.